Kybella, also known as ATX-101, is deoxycholic acid, which is a naturally occurring molecule in our body that helps in the breakdown and absorption of dietary fat. Kybella is the first and only FDA-approved injectable to treat submental fat and to eliminate it completely so that the neck contour and the contour of the area under the chin can be improved on. Kybella is ideal for individuals with moderate to severe fullness of the submental region of the neck. It is really ideal for patients who have some good skin turgor or some thickness to the skin. It's not as ideal for people that have excess skin of the neck in addition to fat under the neck. The best way to find an injector for Kybella is to go to someone that really has a thorough understanding of the anatomy of the neck and the submental region. There are a lot of important structures and organs in the neck that can be damaged if injected in an improper manner. It's really critical that a patient goes to someone that's well trained in head and neck anatomy and has a lot of experience in facial plastic surgery and surgery of the neck region in order to ensure their safety first. At your first consultation, I review with the patient what their goals are and what their desired end results are. I also map out a series of injections on the patient so we can try and determine how many series of injections that a patient will need. And then we also review the patient's dietary history and any dietary restrictions that they may have or physical limitations that they may have to see how this product works as a part of their overall lifestyle. On the day of treatment, we have patients come in and I actually numb the area prior to administering the treatment so that patients are as comfortable as possible. Then the injections are performed in a series under the chin area, and the injections are spaced about 1 centimeter apart. Most patients require anywhere from 1 to 3 vials per session, and most patients require anywhere from 2 to 4 sessions spaced approximately 6 to 8 weeks apart. The body requires about 6 weeks to have an inflammatory reaction, allowing for the skin to tighten and for the skin and underlying muscle and soft tissue to recontour back under the neck. So that's why I require about a 6 to 8 week period for us to make sure that the results that we're seeing are the true results before we move on to the next session. Following the treatment, we often advise our patients to apply ice to the area that was treated. We also recommend that patients use a chin strap that really helps minimize the swelling that patients experience after the procedure. The chin strap doesn't need to be worn 24 hours, but we do encourage patients to wear it at nighttime if they feel comfortable wearing it. Finally, we also recommend using either ibuprofen or acetaminophen, which is Tylenol, to help with any sort of discomfort. The most common side effects of Kybella include some minimal bruising. There could be some injection site redness. There could also be some numbness that can last anywhere from a few days to a few weeks. There can be some tenderness at the injection site and some discomfort at the injection site. But the most common side effect that we have seen is swelling. And the swelling can last anywhere from a few days to a full week, just depending on the amount that was injected. So that's the one side effect that I have patients pay the most attention to, because if it is significant swelling, then it does involve a little bit more downtime than a typical injectable would. Once injected into the subcutaneous fat, Kybella permanently destroys the fat cells. So these cells cannot reaccumulate or store fat. So whatever the result is at the end of a treatment session, those results are permanent. So even 20 or 30 years after the fact, those fat cells and that area of fat do not return. One reason a patient would choose Kybella over surgery is if they don't like the idea of undergoing a surgical procedure. Kybella is a series of injectables so that it negates the need for undergoing general anesthesia or a IV sedation of any sort. So it is considered a non-invasive procedure to reduce submental fat. However, I often caution patients that they may be a better candidate for liposuction over Kybella, because with liposuction, it's usually just a one-time treatment with one downtime associated with it, whereas with Kybella, it is multiple treatments associated with multiple downtimes. So it's really a personal decision. If you are thinking that you wanted to get rid of all the fat in one session, then liposuction would be a good option for you, especially if you have no adverse feelings towards surgery. Now, if you're someone that's very averse to the notion of surgery and undergoing a surgical procedure or an anesthetic, then Kybella is a great option.